Dr. Emma Carr is the co-founder and chief scientific officer at Amara Therapeutics. Emma is a psychologist who specialises in digital health. Amara Therapeutics is pioneering a new treatment for overactive bladder. It's in the final stages of an Enterprise Ireland commercialisation fund and is preparing for spin-out from NUI Galway. Emma, your 3 minutes start now.
US health insurance companies spend $12 billion annually on a condition called overactive bladder, or OAB. OAB affects 16% of the population, and it's the result of a disruption of the signals between the brain and the bladder. This results in increased urgency and frequency of urination, which can lead to episodes of incontinence. As you can imagine, these symptoms impact every facet of a person's life. Patients feel shame and embarrassment. It disrupts their social and work lives, their sleep and sexual relationships. And these patients report higher levels of depression and anxiety. To treat OAB, best practice guidelines recommend behavioral therapy. This is proven as the most effective first-line treatment. Unfortunately, there's a lack of specialists available to deliver it. And as a result, many patients are prescribed medications instead. These have unpleasant side effects, like constipation, dry mouth, and dizziness. That's why we've created Resolve, a software-delivered therapy that gives patients another choice. Resolve is an easy-to-use 8-week intervention that's delivered directly to the patient's mobile device. It's not another health and wellness app, it's a Class 2 medical device that's prescribed by clinicians. Resolve delivers the proven best practice behavioral therapy and includes dietetics, physiotherapy, and psychology treatments to reduce the symptoms of OAB. Our goal is to disrupt the current treatment pathway. Resolve is cheaper than medications, has no side effects, and provides the best practice behavioral therapy. Our initial customers are US health insurance companies, who currently have 14 million OAB patients under care. We can save them money and provide patients with better outcomes. At Amara Therapeutics, we have the team to get this product to market. My co-founders are Dr. Jeff Cundiff. He's our chief medical officer. He's a gynecologist with 35 years experience and key opinion leader in the US. And Brendan Staunton, our CEO. He's a neuroscientist with extensive experience in medical device commercialization. I'm our chief scientific officer. I'm a psychologist with a PhD in digital health and expertise in designing clinical trials. We've just completed our observational trial in 3 hospitals in Ireland. Real patients used Resolve and they all experienced a reduction in their OAB symptoms. Our next milestone is a large-scale randomized controlled trial, which we need to get regulatory approval from the FDA in the US. To achieve this, we've leveraged Jeff's US networks and established a partnership with MedStar Health. We're currently working with them to design our trial, which will take place across their hospitals next year. We're seeking to raise €3 million to gain regulatory approval and begin commercialization. Join us on our mission to transform the lives of the millions of people who suffer from OAB. Thank you.
Thank you very much. Some questions for you. If an overactive bladder is a physical condition, how can you overcome it through psychological methods?
Yeah, it's a great question. So it is a physiological condition, but our psychology can affect it because of its effects on our emotions and our thoughts and how they impact our behavior. So if you think about one of the main symptoms is urgency and the sense of fear that comes with that urgency that's related to the potential of wetting yourself. So I think we can all agree that's a very scary thought. And that drives us to feel anxious, feel fearful, and that can change our behaviors. One of the things people do is they go to the toilet far more frequently than they should, which weakens the bladder because it never gets to be full. They also can engage in things like toilet mapping, which is this idea of you never go to anywhere where you don't know where all the toilets are or how many toilets there are. And you see with people with overactive bladder that their world just gets smaller and smaller because of these emotions and thoughts that affect their behavior and exacerbate the condition.
But even if you have a positive attitude, if there is a real physical need to go, isn't that the need to go?
Yes, well, that urge that I was speaking about actually comes in a wave, and one of the treatments within Resolve is behavioral therapy, which is the traditional effective therapy that's used. And a key component there is urge suppression techniques and pelvic floor muscle training. So it's about retraining your bladder and learning how to control that urge.
Do you see this as been a way of replacing medicines as a treatment for overactive bladders?
We would hope that it would replace medicines for a large portion of the people who suffer from OAB, yes, because it is the best practice first-line treatment. There will, of course, always be patients who need to progress down that treatment pathway, but we would see it, yes, for many people, they wouldn't require medications.
What proof of success do you think private health insurers are going to want?
A lot, and we have a great plan in place. As I mentioned, we have a trial that we're currently designing to take place in America next year. That'll be a large-scale, 400 patients, randomized control trial.
Emma, thank you very much, and best of luck for the future with that.